Welcome to Middle Class Matters Business News in English from Dr CMA Alagesan on CAG Audit Report number 11 of 2023 on Pradhan Mantri Jan Arogya Yojana PMJAY. Part number 19 continued. Thus, shortfall in conduct of audits resulted in a lax control environment with the possibility of unauthorized or excess payment of claims, fraud, and shortcomings in facilities to be provided to the beneficiaries. NHA, while accepting the audit observation, replied in August 2022 that SHAs were busy with COVID management activities and not in a position to achieve the target specified for auditing. Now the auditing system had been streamlined and it was expected to achieve the auditing goals set by NHA. As per 7.12, recovery to be made from defaulting hospitals. As per anti-fraud guidelines, SHA is responsible for developing institutional structures and operationalizing guidelines. Dedicated anti-fraud cell in the state is responsible to carry out surprise inspection, impose penalty, de-empanelment, prosecution, and other deterrence measures, etc. against fraudsters and defaulters. Audit noted that in NHA, out of rupees 17.28 crore on account of penalty imposed on 184 defaulting hospitals pertaining to 13 states, Andhra Pradesh, Chhattisgarh, Gujarat, Haryana, Jammu and Kashmir, Jharkhand, Karnataka, Madhya Pradesh, Maharashtra, Nagaland, Punjab, Uttar Pradesh and Uttarakhand. Recovery of only 4.96 crore had been effected. The remaining amount of 12.732 crore from 100 hospitals was to be recovered in 9 states: Andhra Pradesh, Chhattisgarh, Gujarat, Haryana, Jharkhand, Karnataka, Madhya Pradesh, Nagaland and Punjab, pertaining to the period from February 2019 to May 2021. Audit further noted that Rs 4.66 crore of penalties imposed against the grievances raised by beneficiaries against 164 defaulting hospitals from 3 states: Andhra Pradesh 160, Chhattisgarh 2, Uttar Pradesh 2, pertaining to the period from February 2019 was still to be recovered. In the state of Tamil Nadu, penalty of Rs 55.8 lakh was not recovered from 16 private hospitals. NHA did not have any information of the amount to be recovered in respect of 15 states and union territories, that is Arunachal Pradesh, Assam, Haryana, Himachal Pradesh, Manipur, Meghalaya, Mizoram, Nagaland, Puducherry, Punjab, Rajasthan, Sikkim, Tamil Nadu, Telangana and Tripura. Performance index of recoveries to be made. Total recovery imposed 17 crore 28 lakhs 41,568. Recovery effected 4 crore 96 lakhs 21,705. Recovery yet to be effected 12 crore 32 lakhs 19,863. As per the above table, it is seen that in Jammu and Kashmir, Maharashtra, Uttar Pradesh and Uttarakhand, pendency of recovery is nil. However, in Chhattisgarh, Gujarat, Jharkhand, Madhya Pradesh, Nagaland and Punjab, pendency of recovery is very high. Audit further noted that SHA, Jammu and Kashmir and Ladakh failed to levy penalties amounting to Rs 20.93 crore and Rs 39.66 lakhs respectively on the insurer for non-performance of various activities mentioned as key performance indicators in contract agreements. Since no penalties were levied by the SHAs, no such recoveries were made from the defaulting hospitals, thereby not deterring the hospitals from deviating from the performance indicators specified under the scheme. Further, due to delay in payment of premium to the insurance company up to 161 days under contract agreement PS4, SHA Jammu and Kashmir failed to recover penalty of Rs 2.91 crore on account of delayed claim payments from the insurance company. NHA, while accepting the audit observation, replied in August 2022 that NHA is working on a guideline wherein central share would be released to the state only for clean state cases, that is, cases where no action is pending. 7.13 Non-rotation of Pradhan Mantri Arogya Mitra PMAY. Pradhan Mantri Arogya Mitra is a certified frontline health service professional present at each EHCP who serves as a first contact point for beneficiaries in order to streamline the health service delivery and provide a seamless experience. As per anti-fraud guidelines, to avoid collusion among PMAM hospitals and patients, if possible, SHA should rotate PMAM or insurance coordinator every 3 to 6 months, preferably within the same city or town. Audit noted that in two states, Himachal Pradesh and Tamil Nadu, PMAM in test-checked hospitals were not rotated frequently. NHA replied in August 2022 that as per anti-fraud guideline, it was suggested by NHA to rotate the PMAM periodically to avoid collision. However, it was not made mandatory. Reply is to be viewed from the fact that para 4.2.2 of anti-fraud guidelines nowhere stipulates that it is not mandatory in nature. Chapter 8 Key Initiatives Undertaken in PMJAY. 8.1 Key Initiatives by NHA. National Health Authority has been provided with full autonomy, accountability and mandate to implement PMJAY. Some of the key initiatives undertaken by NHA in PMJAY are given below. NHA launched a mission mode campaign, Aapka Dwar Ayushman, to ensure free insurance issuance of cards to beneficiaries undergoing verification during January 2021 to April 2021. NHA has unveiled Arogya Shiksha, a digital platform to support capacity building initiatives for PMJAY stakeholders. It facilitated the launch of Ayushman Bharat Sehat Universal Health Insurance Scheme for Union Territory of Jammu and Kashmir in December 2020. It has facilitated a campaign for migrant workers, Ayushman Bharat Ki Chua Shahar Ho Ya Kon. NHA entered into MOUs with CSC and UTII TSL for mass issuance of PVC quality Ayushman cards. The cost of ₹20 of such cards is fully borne by NHA. NHA call center took initiative of dissemination of information on COVID-19 precautionary measures via National Helpline number 1075. NHA has launched a program to converge PMJAY with other major health insurance schemes and programs for ESIC and CAPF, building and other construction workers, Rashtriya Arogya Nidhi and Central Government Health Scheme on NHA IT platform. 8.2 State-specific initiatives. State-specific initiatives noted during the course of performance audit are discussed as under. In Andaman and Nicobar Islands, geographic landscape makes it uniquely challenging to provide access to healthcare. To make the portability feature convenient, SHA of UT collects all medical documents of patients and informs SHA of the state where patient is intending to receive healthcare services. All beneficiaries using the portability feature under PMJAY are also provided reimbursement of transport cost and wage loss compensation by SHA. In Andhra Pradesh, treatment is provided beyond the limit of ₹5 lakh per family for cancer and heart diseases. In Assam, beneficiaries who went outside the state were given airfare of up to ₹30,000 per annum per beneficiary and one attendant. Additionally, TADA of ₹1,000 per visit in case of treatment outside the state and ₹300 per visit within the state is provided for a maximum of 10 days. This amount was given from the state fund. In Gujarat, the state government is providing rupees 300 as transportation expenses to all PMJAY beneficiaries per hospitalization. Out of pocket expenditure and overall healthcare cost incurred by the beneficiaries are thus minimized. In Haryana, 100% Aadhaar seeding of Ayushman card and 100% biometric authentication at the time of hospitalization except neonats has been done. In Himachal Pradesh, district Kullu achieved 100% enrollment of all the eligible beneficiaries as per SECC data. In Jammu and Kashmir, extra expenditure on patients over and above approved amount of claim is being borne by public hospitals from hospital fund. In Karnataka, SHA established a call center as a monitoring unit of the scheme. The call center contacts all beneficiaries at the time of discharge for getting feedback regarding out of pocket expenditure of the scheme and co-payments made if any. In Kerala, government hospitals caters to all procedures notified through HPP 2.0, that is 179.61 crore was paid against 73,790 claims relating to COVID-19 treatments. In Manipur, SHA had collaborated with Tourism Department, MAHUD, Manipur State Legal Services Authority, leveraging in the events organized by these departments for generation of awareness and increase in enrollment, and currently taking active participation in government sponsored program Go to Villages. In Mizoram, SHA followed the system of offline collection of data in regard to the beneficiary identification system BIS. Teams from SHA were deployed in the peripheral areas of the state who collected all details of village-wise beneficiaries. In Nagaland, state government had engaged 6 organizations to undertake outreach beneficiary identification and verification drives in 8 districts. In Puducherry, SHA took up with NHA issues of mismatch of SECC data, which was the main hindrance in identification of eligible beneficiaries. Accordingly, SHA got NHA's approval for utilizing the dynamic data of National Food Security Act for identification of beneficiaries, and target was increased from 1,03,434 families to 1,77,733 families. In Rajasthan, after treatment, a feedback form is filled by the beneficiary stating that no charge of any kind is collected from beneficiary for treatment given and whether he is satisfied or not with the treatment given. In Tamil Nadu, a corpus fund has been created. 27% of every insurance claim of government hospitals is being credited into the corpus fund. High-end procedures involving more than rupees 5 lakh per case is paid from corpus fund for the poor persons. In Uttar Pradesh, state government conducted an additional data collection drive to identify left out eligible families on the same deprivation and occupational parameters of SECC 2011 to ensure that these additional families are provided with same benefits of PMJAY. Please like the video, subscribe to the channel and share it to your friends and relatives, as many people as possible, to understand how our taxpayers' money is being spent by the government. Thanks for watching.